Hi, this is Dr. Hud, cancer surgeon and health coach, here to help women recover fully from breast cancer, live their best lives, and reduce their risk of breast cancer recurrence. Today I'm going to talk to you about how exercise helps you to beat breast cancer. A 2017 Canadian Medical Journal article summarized the lifestyle factors that can be modified to reduce your risk of cancer recurrence and also dying from breast cancer. And it found that one of the most important factors was exercise. Now let's quickly have a look. Let's explain what I mean by reducing your risk of recurrence and death. Now, when breast cancer is first treated with surgery, chemotherapy, radiotherapy, the aim is to control the disease, try to eradicate any cells that have escaped from the cancer, because these can then develop into metastases and cause you problems. And the purpose of those treatments is to control the disease in your breast, in your armpit, and also in the rest of your body. Following that, you then have some people have certain treatments like anti-hormonal therapy to reduce their risk further. Some people have it for 5 years, others for 10 years. And the purpose again is to reduce the risk of recurrence and death from breast cancer. And those two are separate but overlapping things. Recurrence means that the cancer comes back in the breast or in the armpit. Now, this in itself doesn't mean that you're going to die from cancer, but it is very distressing in itself, because it means that the cancer is back in the breast. It requires maybe further surgery, can require further treatments. And if this does come back, it does mean that these cancers that have come back can throw off further cancer cells, which go to the rest of your body and cause metastases. Now, many patients live for several years with metastases, but again, that's not an ideal situation. You want to reduce the likelihood of that, because you don't want to have chemotherapy, and if your body is overwhelmed by the metastases, that unfortunately causes somebody to die from breast cancer. So exercise is one of the many things that you can do to reduce your risk of the cancer coming back, and I want to talk about how that happens. Now, it's important to stress that not any kind of exercise reduces your risk. You need to do exercise that stimulates your heart and stimulates your muscles. So simply just going for a walk in itself isn't going to reduce your risk significantly. You don't want to be doing athlete style exercise. You just need to be doing the right level of exercise regularly that stimulates your heart and stimulates your muscles to reduce your risk of the cancer coming back. So let's talk about how exercise reduces this risk. Number one, it lowers inflammation. So stimulating your body's heart and muscles has an impact on messenger hormones that have an impact on body level inflammation. Now, inflammation is something that your body uses to combat certain things like infections. But when it's uncontrolled and for long periods, it does increase your risk of things like heart disease, diabetes, and also increases your risk of cancer. In the context of having cancer itself, having high levels of inflammation means that you're more likely or less likely to combat the cancer, and more likely the cancer that will come back. So doing things that lower inflammation means you're less likely to have breast cancer recurrence. So exercise lowers inflammation. Number two, exercise improves insulin resistance. Now, insulin resistance is where your body has to secrete high levels of insulin to control high levels of blood sugar. And it's a spectrum. So patients who have severe type 2 diabetes have very high levels of insulin, uncontrolled levels of sugar, and they are at risk of developing things like heart disease, strokes, vascular disease in their legs. And you have a spectrum of that where you can have insulin resistance, where your body has to work a little bit harder to control the level of sugar in your body. And the most important way of controlling that is by controlling your diet, which I talk about in a separate video. But exercise in itself, on its own, lowers insulin levels, improves insulin resistance, and that does have an impact on cancer, because high levels of insulin, high levels of growth hormones related to insulin help certain cancer cells survive in the circulation. So you don't want that. You want to control insulin levels with your diet, but also with exercise. Number three, exercise has an impact on estrogen. Estrogen is the female hormone that for most kinds of cancers helps them to survive. So that's why people take anti-estrogen tablets for several years, so 5 years, sometimes 10 years, to control that. Exercise also has a small effect on controlling levels of excess estrogen, which will help cancer cells survive. And number four, exercise has an impact on your weight. Now, the most important way to lose body fat, which, as I mentioned in other videos, reduces your risk of cancer coming back, most important way is through diet. doing the right, carrying out the right kind of diet that lowers your body fat and nourishes you is the best way. But exercise also has an impact on that, because it gives you an extra few percentage points to lower your body fat levels. So by lowering your body fat levels, this reduces inflammation and also has an impact on estrogen, again reducing the risk of cancer recurrence. So in summary, the message is that carrying out a regular exercise that stimulates your heart, stimulates your muscle, goes a long way to reducing your risk of cancer coming back after you've completed your treatment. I hope you found that video useful. If you have, then please look at some of the links below, subscribe, and if you have any questions or comments, please put them below, and I'll see you on the next video.